Good morning, everybody. Welcome to episode 122 of the School of S.H.R.E.D podcast here with me, your host, John Reed, your holistic health and fitness coach. This is the show that's designed to help you shred your old and make better your new. And by golly, we're going to be getting better today. We're going to talk about pain today. I realized as I was on my morning walk this morning, we're 122 episodes into this show here, and I haven't gone over some considerations that one should take when exercising. Pain is a big one, pain, we need to know what's good pain, what's bad pain, what we should be cautious of, what kind of pain we should be cautious of, and then maybe what to do about it. So that's what this episode is going to be all about. So go ahead and throw me a flex emoji in the comments. Let me know where you're at, where you're located. Let's congregate, S.H.R.E.D Nation. Let's do this thing. It is a beautiful, what is it? Thursday morning right now? It's a Thursday morning right now. We're in a global pandemic. So there's 3 days a week. There's yesterday, today, and tomorrow. There's no longer 7 days in a week. So welcome to the show. We're here Monday through Friday at 9 a.m. Pacific Standard Time. We're on Facebook, Instagram, and YouTube. So you got audio and video and all that jazz. And then if you want to just take the show on the go with you, on your walks, do a little learn and burn, or working, whatever you need is. You can also just take the audio. If you go to Spotify or iTunes, you type in The School of S.H.R.E.D, subscribe, give a review, help the show grow organically. That goes for YouTube as well. Interact. Facebook, interact. Instagram, you best interact. Shout out to Instagram. How you doing this morning, Instagram? So today we're talking about what is pain. Or not what is pain, but what pain? What pain? What pain do you got? I'm going to take a little drink of my coffee here. My heavy cream coffee. This is a good one because for those of you who don't know, what I do in person is I've really shifted kind of my in-person business model, I would say, the last few years. When I first got into fitness and training, it was about being a slave grinder. It was about trying to be the hardest trainer in the gym and get kudos that way. And I used to just wreck people and thought that was what good training was. Just because if you're the loudest in the room, you're surely the best, which couldn't be further from the truth I've found in the 9 years I've trained. But I used to go for the market that most people want to go for, which is the younger demographic of people, 20 to 35, who want to lose some weight, who you can get great transformation pictures from. But now I don't do that anymore. As I've learned more and I've wanted to serve the community more, I've realized that the baby boomer population and the population of folks out there who are battling with pain and injuries every day of their life, that's the market that I want to go to. And what really changed my mind and shifted my perspective was this education course that I traveled to called RTS, which to this day is my favorite course I've ever done. And it's kind of like getting a black belt in jiu-jitsu, where it's a lifetime discipline. RTS is like you never had it summed up. You get little wins here and there when you study this type of stuff because it's a deep dive into mechanics and exercise mechanics, which is a combination of joint mechanics, resistance mechanics, understanding your tools and how you're loading your client, and then also muscular mechanics. So it's just very, very deep field of study. And so with that, though, it opened my mind to, hey, there's a whole population of folks out here who need really good training that are in pain. We need to get them out of pain. And this is not physical therapy. This is called contracting muscles, but we have to learn how to dose clients the right way so they're not in pain, because there's a huge difference between loading a 25-year-old who's an athlete who maybe played, college basketball, and then trying to load a 55-year-old client who maybe had a knee replacement, a busted ankle, ripped all their rotator cuffs off in their left shoulder. There's a lot that you have to navigate there. And I think that, that used to be intimidating for me. It no longer is now, because I just know how to try and back off exercise enough. And it's a great privilege because those people are very motivated to get out of pain. And so I feel like I'm actually doing the Lord's work after 9 years, where I'm helping people who are highly compromised. And one of my mentors said, you don't know how good of a trainer you are until you have somebody who can't do anything. When you have a client who can't do anything, and you have to be humble and go, okay, I got to go back to the drawing board. Okay, I got to go back to the drawing board. Okay, I got to go back to the drawing board. Instead of getting frustrated and going, God, this person's they're broken. They can't do anything. Well, it's our job as trainers, I feel, as professionals. If you want to be an exercise professional, the way I look at being an exercise professional would be, you got to find a way to help that person. And so it all revolves around pain, and there's good pain and there's bad pain, or maybe cautious pain. I want to be careful of using the word good and bad. I think there's definitely good, muscular pain. We're going to talk about that. Where you don't want to be a sissy. You want to be strong and capable. But at the same time, we have to also acknowledge that there is check engine lights that come on, and a check engine light should tell us that, hey, maybe we need to pull the car into the shop, get an oil change, pull it over the side of the road, see what the heck's going on here, so we don't cause further issues. Because what happens is your body, what I have found, but with the folks that I train, is your body will start off, it'll whisper something's wrong, and then it'll talk in a nice gentle voice, and then it starts to shout, and before you know it, it's screaming at you. And by the time it's screaming at you, you usually, if you can do something about it, you have to really alter your fitness in your program. So this is just kind of, a trainer sharing thoughts with you on maybe how to differentiate pain. All right. So we're going to break this thing into 3 categories here. All right. We're going to talk about muscular pain. We're going to talk about orthopedic pain, which would be joint pain. And then we're going to talk about nerve pain today. I would not say that I'm a pain specialist by any means, but I definitely am a contraction specialist, and I understand muscular contractions enough to know that, hey, maybe I need to back off with this client, as opposed to say no pain, no gain. I think that humility is really important when we're talking about pain. So the first thing that we'll get into here is muscular pain. So muscular pain, this is the kind of pain that we want. This is the kind of pain that we're looking for. If it burns, it grows, is what Arnold Schwarzenegger said. Now, there's a huge continuum here, right? You have to take all of this stuff into your logical brain and realize that all this is on a continuum. Everything's a gradient. So, muscle pain is generally good, but it's not always good. So, and we're going to talk about, the wins and ifs there. But anyway, muscle burning, like lactic acid burning up when you're doing repetitions with weights and your muscles are burning. That's great. That's awesome. That is one metric that you could use, our main metric actually to use to know that you're targeting the muscle that you want to target. So if I'm trying to train my biceps and I'm doing bicep curls, my metric of, am I contracting that muscle, is, can I feel it? Can my brain connect to that tissue? And am I getting a nice burn and a lactic acid burn in there? Now, it's different if you're doing, say, a heavy split, right? Where you're loading very heavily. So maybe you're doing like 5x5s, or you're doing sets of 3 or something like that. Well, you're not going to get a lactic acid burn, but you are going to get some muscle sensation. And this all depends on how you execute the technique as well. But this is generally good stuff. This is the good pain that we want. If you start to feel that pump of that blood flow, the cell swelling and volumization when you work out, maybe you're doing high reps, that 10 to 15 rep range, or you're knocking out sets of push-ups, like 20, 30 push-ups at a time, and you start to get that cell swelling. A lot of guys like that because you look more muscular for a short period of time. That's all good as well. That pain that leads to that extreme blood flow to the muscle, that's what we want. We want to capitalize on that. We also want this pain to be diffused in the middle of the muscle. All right. So if right now I'm touching my bruised bicep here. I got a bruise from an activity that I like to do that I can't talk about. But anyway, so but anyway, through the middle of the muscle belly, okay, that's where we want to be feeling it. Not at the ends, and we're going to talk about that when we get into orthopedic stuff. Then we have DOMS effects, so delayed onset muscle soreness, and so this can really wreak havoc on the body and on your mind. So, for instance, I always have to warn clients that if I'm teaching them something like a Romanian deadlift, which is where you have a fixed knee position and then you're doing a hip hinge movement, and so primarily the muscles that's known to hit pretty hard are the hamstrings, the glutes, and the lower back, the spinal extensors and the hip extensors. When you're hitting those guys hard, they tend to get really stiff and really sore, and specifically the lower back. And people just aren't used to having a sore lower back, and most people are scared of lower back injuries, as they should be. I've seen statistics that 30 million people a year have to go to the doctor for non-contact back injuries, which is interesting. It's this sitting epidemic that we have. And so when you train muscles like that, like your back, it's perfectly fine to be a little bit sore, depending on who you are, what your goal is, but it's perfectly fine to be sore. If you want to gain muscle tissue in that back, it's okay to be sore there. You might be sore for a couple days the first few times that you're learning the technique. I like to not have clients be overly sore. I don't think that being sore is a magic cure. I think that it's way overblown. Personally, I think that this stuff happens on a cellular level and a hormonal level, muscle growth, and we don't have to wreck our body and be sore for 3 days to see muscle gain. That the analogy would be like you need to go get sunburned to get tan. Well, the reality is if you go get sunburned, you have to stay out of the sun. I think we would agree. If you're smart, you stay out of the sun when you have a sunburn. Then you peel, and then you lose the color that you worked so hard to go get. Well, exercise is the same way. If it's a hormonal response and we want to be working out most days out of the week to send a continuous anabolic signal through exercise, it would make the most sense that we wouldn't want to wreck our body to where we're less effective and we can't contract muscles throughout the rest of the week. And what I mean by that is I'm not just saying that if you train one muscle today, you could potentially train another tomorrow. You have to consider the fact that your central nervous system will not allow for optimal muscular contractions even in a different muscle the next day, because central nervous system fatigue carries over from workout to workout. So we want to be mindful of this type of stuff. But anyway, DOMS effect is that 24 to 48 hour period where you're sore after your workout. That type of pain is an okay pain. What I would say is if you're sore 48 plus hours after your workout, you might want to adjust the volume that you're doing for the short period of time and allow your body to adapt and then go up from there. If you have short cycles, say 2 to 4 weeks, where your work and your main goal is hypertrophy and you're working out of that extreme muscular soreness, that's okay. I mean, that's something that I like to explore. But that's a short period of time. I wouldn't say that you should hold yourself to that standard all of the time where you're always miserable and always sore and always tired. That pain might be too much, but that's up to you. It's not as alarming as what we're about to get into. And so now we're going to talk about orthopedic pain. So orthopedic pain is joint pain. It's basically pain that would be inside the joint. So if you think about like inside the knee, if you're doing squats, like, man, something just doesn't feel right in there. Or your ankle, right? Or your hip, inside your hip joint, something feels stiff, or you got your shoulder, elbow, right? Pick a joint, name it. Your whole spine, that's comprised of a bunch of individual joints. Your spine is. If something doesn't feel right, this is where we need to start pulling the car over and taking a look. Is pain at the joint or in the joint? And to jump back into this, where should you be feeling the muscular pain? Because this is more of a tissue type pain, but it's also kind of a joint type issue too, because it's around the joint. That's why I'm bringing it up here. Is pain at the musculotendinous junction. So if we're looking at our bicep and we think we're sore in our biceps, but we're sore where the tendon kind of inserts into the elbow, that right there could be a sign that we are damaging passive tissues that don't get blood supply and they can't recover as well as active tissues, which are like muscle tissues that get blood supply and they can recover quickly. And so what happens is long-term, we could be putting ourselves at risk for slowly tearing apart these tendons to a point that we cause an injury. So something we want to be aware of is that we don't want to be sore in the musculotendinous junction. It's best to be sore throughout the middle of the muscle belly. You're always going to be a little bit sore towards the ends, but not like into the joint. You want to be starting to look at how you executed and performed the exercise that you did. Maybe you were going too fast and there was a lot of inertia at the end range where you were in a completely lengthened muscular position, and that could have been doing some damage over time. So, or it can do some damage over time rather. And that's some ortho pain. And then what happens with all of this, if we're doing any type of joint damage or we have joint pain, orthopedic pain, is that it's going to cause some inflammation and we're going to hoard some water there. And that's typically where we start to get the pain, is because the joint swells up. And usually physically you don't see it until it's really bad. But a lot of us are inflamed. And this comes from dietary choices as well. This is a big part of this systemic inflammation, where when we eat something and maybe we get, leaky gut syndrome, inflammatory intestines, where when we eat a food, we get an inflammatory response or an immune response. When we eat that food, say if you have like a slight, peanut allergy or something like that, you don't handle them very well, and you have some peanut butter, you might get some joint swelling there. And so it doesn't help if your exercise is also causing some joint swelling. And so that's also stiffness. If you feel stiff, if your joints feel stiff, I know from jujitsu and grabbing gis and stuff like that, when I'm rolling, my fingers get stiff, and it's just kind of the name of the game. I mean, I'm kind of giving up my finger health a little bit, so it makes it tough. It makes it to, you kind of got to give a little to get a little, you know what I'm saying? But I just play guitar to really try and help my hands out. So that's orthopedic pain. So orthopedic pain, we want to pull the car over. If we're feeling pain inside the joint, if we're feeling joint inflammation, stiffness, if we're sore after a resistance training session in the musculotendinous junction, we want to start looking at that. The next thing we're going to look into here is nerve pain. Now, this is one we want to be careful of as well, is nerve pain. So nerve pain could be some tingling, some stabbing pain, some sharp pains, things of that sort. You want to be very aware of that. Say if you get like a tingling hot pain in your lower back when you're going to do something, I would recommend that you abort that and start to go back to the drawing board and look at, what you're doing. Maybe you need more of a warm up. Maybe you should do that exercise right now. Maybe you should alter the range of motion on that exercise. So nerve pain is something that we definitely want to pull the car over and be like, okay, we don't want to be violating that just to get a muscular challenge. And this was a big idea, or piece of knowledge to ponder for me when I got into it, which is you can stimulate muscle tissue, which we would consider healthy, but put the joint at risk or put the nerves at risk. So there's this give and take, but you could also challenge a muscle and maintain healthy joint positions the entire time, or not violate what these other systems have. And when we start to look at connecting all of these systems, I think that's where our longevity will flourish, is when we look at combining all of these and not giving up joint health and orthopedic health for the sake of trying to grow some muscle now, because we think that muscle tissue is so metabolically active and it's very important, which it is, but so is joint health. You only have one cartilage system. When it's gone, you don't get another chance. You either have to get a joint replacement or you live in pain. And then, I know people who've got hooked on painkillers, who get hooked on, drugs and alcohol because the pain is so bad in their back, And so it's just a place that I don't think we want to go. And we sure as hell don't want to go there when we're trying to exercise to get healthy. Exercise is supposed to be medicine. Let's look at the ground level here. If you're exercising to be healthy, not to play a sport, but to be healthy, we're exercising for medicinal reasons. So we would not want to engage in something that's supposed to be medicinal that's actually ruining our long-term health. And that's why we're talking about this. And that's why it's important to exercise the correct way and to understand things like inertia and to be smart and to continually be a student. Even if, your job, it doesn't pay you to be in shape, I think is one of the most important things that we can all embark on, which is our health and fitness. So there's something that I learned in a course, and it was progress, regress, or abort. So if we're doing an exercise and we're getting any pain that might not be what we want, okay? So we just went over muscular pain, orthopedic pain. We went over nerve pain. Say you're getting orthopedic pain or nerve pain, and something just doesn't feel right. You can regress the exercise. So what do we mean by that? Well, let's take a squat. A lot of people like to do squats. Squats are a big one right now that people are doing from home, even air squats. So say like the last 2 inches of the range, you get kind of this like little impingy hip thing going on. Where you're like, my hip is bugging me today. The first thing that you can do that, is I wouldn't abort right away. You can slow it down. That's a great way. I mean, most people go way too fast to think that inertia is way present. They're not actually owning the range with their muscles. They're going through the range and hoping for good stuff to happen. And so first thing is become very alert, very aware of what's going on in the muscle tissues that are guiding that exercise. Pull yourself slowly to the ground, push your feet through the ground like you're trying to break the floor when you accelerate to the extension and the top portion of a squat. But so that's like the first thing is just make sure you're controlling your tempo. It's slow. But then you can also regress by going a little more shallow on the squat. And I know this is like sacrilege to some people out there because some people are so dogmatic about thinking you have to get to a certain range. They cannot possibly fathom the fact that you could actually stimulate muscle tissue with isometrics. How do you think they get people off of bed rest? They have to do isometrics. You have to be able to walk. You have to be able to contract your muscles before you can stand. Okay. You have to be able to stand before you can walk. You have to be able to walk before you can run. Okay. And you have to be able to walk and run before you can actually go into the gym and work out. So there's a much bigger global view here. So if you have to cut 2 inches off of your squat because you're not getting pain, I would recommend that you do that and be smart. Don't allow people, especially if they call themselves professionals, to say that you have to squat ass to grass or you're not going to get any benefit. If it's something that's causing you pain, do not do it. If you can get down there and it's comfortable and it's fine, you're just, maybe you have to condition your muscles a little bit. That's perfectly fine as well. There's nothing wrong with that. But range of motion is dictated by your structure, not my structure, not what I can do on camera for you and say, hey, everybody needs to be able to squat like a newborn baby. Everybody needs to be able to stay super upright. We all don't have the same dorsiflexion ability because the subtalar joint, you might be running out of joint space. It's not necessarily just because you're tight. I see a lot of people blame themselves for having tight muscles when they might just have a structural thing going on. So we don't want to violate that. We should take that very seriously. So anyway, furthermore, when we're talking about squatting really low, and this is just an example, but you shave off a couple inches and then maybe the pain goes away. Okay, great. And then what you can do is you do some sessions with that range of motion. And then over time, you can maybe try to go a little bit lower. There's nothing wrong with that. There's nothing wrong with that. Going a little bit lower, as time goes on, as long as there's no pain, then you work your way back up. So then you start progressing again. But say you shorten the range of motion of the squat and you're still getting pain. Okay, at that point, you've shortened the range. You kind of just tiny little squats, not really doing a whole lot. Well, then abort and try something else. You progress, regress, or abort. Let's see here. Look at my notes. The last thing that I got to say is just find a range that specifically fits to your mechanical needs. There's a lot of general information out there, and the more I've learned, the more I've been schooled and been humbled, the more I feel it's unethical for people who call themselves professionals to be recommending the same exact range for every single human being. We all have different cheekbones. We all have different humerus lengths. Look at some cadavers. People have different femoral heads or necks, lengths like that connect their femur into the hip socket on both sides. But the issue is that people they don't see this stuff. And so they just think that the body's supposed to be super symmetrical, and it's the body's tight. We got to start thinking a little differently here. We got to be a little more open and not so dogmatic, and realize that everybody has individual needs. Okay. And so if you're putting a mobility program together, it might not fit your plan, when you have to realize that things need to be customized per individual, but they do. Things need to be customized per individual. And until you work with a demographic of people that cannot do most traditional exercises, you will never learn this firsthand. And so this is what I'm bringing to the table today is I'm talking about there is a difference in pain. There's some good pain, there's some bad pain. And when we have the considered bad pain or cautious pain, there's a lot that we need to do. And sometimes the exercises that we do to the outside observer might look like not a full range of motion. Okay. But in order to get somebody better, sometimes we have to regress things to be an ethical professional. And so if you are out there and you're working out, I want you to adopt this as well. Adopt this in your own workouts. Don't have an ego around things. If you have sore knees or sore joints and you're getting issues or your back is hurting, there's something you need to go back to the drawing board and figure it out. This is what I do professionally with my in-person clients. This is what I do is I try to find how to load the body with understanding resistance mechanics, and then what do they have available to them as far as joint range and joint motion, and then how can we slowly progress it from there, right? That's important. So that's what pain is. What pain? Pain? What pain? So you muscular pain, orthopedic pain, nerve pain. Take notes every time you work out. Always be open to adjusting. And that is episode 122 of the School of S.H.R.E.D. Thank you for tuning in. Tomorrow we'll be back with a Q&A episode. So go ahead and ask your questions today if they're on pain. What else did we talk about? We talked about energy this week. We talked about spirit training. We talked about keto a little bit. So ask any questions you guys got, whether it's on spirit, mindset, for working out, environmental toxins, workouts, at-home workouts if you're stuck at home right now, nutrition, whatever it is. Throw the comments down in the comment section or direct message me. I will jot them down today, and we'll be back tomorrow with episode 123 of the School of S.H.R.E.D, our Q&A Friday. So get your Hawaiian shirt on tomorrow, and let's do casual Fridays. All right. Thanks for watching and or listening. And with that, I want you to stay strong and healthy in body, stay relentless and energized in spirit, and stay determined in your pursuits today, and stay away from the bad pain out there. Only the good pain. Go seek good pain in the muscles. Now spell S.H.R.E.D, now go shred your day and get better in every way.